how do you see global medicine and alternative medicine fitting into the U.S. healthcare system? Shri, you want to start with that one? Does it fit?
Well, I think that whether or not we, those of us that have been trained in allopathic medicine, if you ask a little bit more deeply with your patients, they're all using alternative, what we call as alternative medical practices, whether it's acupuncture or different herbal products. So I think that the patients have already led the discussion and are already integrating it. So I think that what needs to happen is that because we're such a curative approach to healthcare right now in the United States, that if you want, for example, gastric bypass, you can get that covered by your insurance, but you can't get a nutrition consult paid for where a nutritionist sits down with you. And I think if you're going to have people like midwives that currently Medi-Cal, if you have Medi-Cal, you can't get a midwife to deliver your baby. All of those have to come under, compensation for these practices. And right now, it's almost entirely out of pocket. So I think that there probably has to be evidence in kind of the allopathic way of thinking about evidence in order to sell the policymakers, and then there has to be kind of payment schemes to pay for acupuncture and the rest.
I think acupuncture has taken a great lead in that too. We have some of the best NIH evidence right now on acupuncture for stress and reduction and pain reduction. So you will see some insurance payers starting to pick that up. We just live in a great spot here at the Pacific Rim in San Francisco. We have available to us so many of the different healing systems from around the world. You can go to Ayurveda health centers here. You can go to Institute for Health and Healing. You can get a variety. I think that it's always a matter of, you're right, the evidence base kind of catching up to convince insurers, and that's happening slowly. I think it's wonderful to have more interprofessional education in which our medical school training it's such a dense curriculum. It's really tough to start introducing more of these healing options from around the world. But there's a long and valid history of them, and I love investigating them.
Yeah, great. And I think for an editorial comment here, I think in large part we look at global health and global health practices as sort of going back to ancient wisdom, or going back to cultures that had a different way of knowing and of viewing. In the East, it tends to be far more, you need to know the forest before you're going to figure out the trees. And in the West, it tends to be, you need to know the trees before you're going to figure out the forest. And both systems are right, but our thinking in the Western construct has been far more linear and reductionist, and in the Eastern, far more holistic and subjective or empiric. And I think the train in contemporary medicine has already left the station, regardless of what the Supreme Court does, regardless of what our, when you were talking about possession, I was thinking of our Congress, people who believe their piece of the view and are stuck on it and unable to see beyond that view into a more holistic, even a more holistic conversation. Yeah. But I think the train has left the station with regard to the evolution of healthcare in this country and in the Western world, frankly. And we will see more so-called alternative or complementary or integrative therapies, because that's what patients want. They want access, and they want relationship. And so, how would you then respond to the argument or the question or the comment that the U.S. really ought to spend more of its focus on the growing health disparities at home than on the global scene?
let me tackle that a bit. When there was a large survey that was just done, you might know about this one, that said to Americans, how much do you think that the U.S. spends in global health efforts around the world? You saw that? And
Yeah,
everybody
I saw
said,
that.
oh my God, it's got to be 25% of our budget. We spend big dollars, and it's like 1%. We don't spend a lot compared to other nations there. So does that 1% that we're spending in funds abroad, does it go to a lot of good? I'd say it absolutely does. I think also that there's ways that we can do a lot more. And what was the second part of that one?
Health disparities internationally versus health disparities
Right here?
Right here.
We've got, in San Francisco, the county health department has one of the few health equity departments in the world. And we do almost 2 to 3 times the spending per capita in the city and county of San Francisco on trying to reduce health disparities. So there's places in the U.S. that have a strong agenda for it and really good person power addressing it. And then there's other places like some counties in Alabama where you have a lifespan disparity that is so different from Boston area. Boston area, you can live to about 80, and there's counties in Alabama that are 62. And so just with county-to-county figures and disparity in the U.S., but I think that as long as we have forces like, people who want to dismantle affordable care, who want, a green tea agenda, they want rights within that own county for women to not even have birth control. I find it mind-boggling. I'm going to get on a soapbox here in a second. But they want individual rule over that county. I think that's when we're really going to run into increasing disparities. What do you think?
I completely agree, because I think it's the and, it's not the or. You should be doing what the speaker last week when he spoke about, if you guys were here, he spoke about housing as health. And housing, he showed this one curve that showed if you're HIV positive and you're housed, it has kind of the best intervention that you can possibly think of any intervention, health intervention. And so this idea that you can either do it abroad or you can do it in the States, I think it's like a scarcity view of resources instead of there is resources to kind of do both. It's just a matter of priorities.
Yeah, priorities and how we use them.
Yeah.
So would each of you be willing to share an experience that serves as your defining moment in your work?
I'm first.
Nice, straightforward, simple little question.
Defining moment. That's a great question. Do you have one?
Should we come back to that one?
Yeah, that's
take
really a
on-
beautiful question.
Take on something else? Because there are similar questions. There's a similar question here about personal challenge
Ooh, I
in
got one.
balancing your life with your work, which I think is a little bit related. And so,
Here, I'll do the defining moment.
are you ready? Are you ready to kind
You've
of
got one?
launch
Yeah, we've
into-
got one. We're back at that. That's such a great question.
Well, I think that when I was in Burundi in 2009, I had seen about 9 children under the age of 5 die of malnutrition, and they just come in and they're so emaciated and they're so irritable at that point, and they just continue to die. And I was looking through a medicine book it's called Health in Africa, and you open up the book, and based on 40 years of work, no matter how poor your health system is, you should not have a rate of death of more than 15% of children dying. And so this idea that if you have basic health systems and you think about care creatively and innovatively, then with very little resources you can do a whole lot. And it doesn't take tremendous heroic efforts of one person. It's really putting in systems in place and putting in action of a whole lot of people, and you can have, remarkable outcomes. And I think that just seeing systems that have been ignored for so long that have outcomes that just don't need to be there.
Yeah, good, thanks.
So true, boy. Defining moment I had, I was always trained in medical anthropology to say, the magic only works if you believe it. So when you go to Ecuador and work with a shaman, know that you don't have to go native, just be a non-believer, and then you can be a good participant, observer, investigator. And I was in a marketplace, and all of a sudden, I just got this horrible pin, like thrusted between my shoulder blades. Just like somebody took one of those big hat pins off and just shoved it right in there. I was, ow, ow, ow. And I asked people at the marketplace, can you pull that out? There's some big knife thing in there. And there wasn't. Somebody pointed across the way, there was a competing sorcerer shaman who blew a air dart at me, a poisonous air dart. And I was starting to go down in a cold sweat and collapsed in the market, and I was ministered to by a local curandera, Ermelia, who was doing her limpia, her herbal wrap, who was blowing tobacco smoke on me and praying over me. And I came around in about, pretty quickly, in a few minutes, but I was really nauseous, and she attended to me the rest of the day. And she pointed to who threw a spiritual poison dart at me. So this was a supreme case of, I didn't believe in the magic, and yet something severe happened. And so it was a humbling of, my gosh, we grow up here in the West with our knowledge of Western science, our empirical sense of it, our reductionist methods, and yet we don't have a full picture of what goes on. We have a good slice of the universe, and we do it really well. So it was a moment of humbling awareness of, my gosh, there are energies afoot that I am totally a white belt about.
Yeah, great. And I'm going to bring a few of these questions together because I think both of you have an extremely broad perspective and significant personal experience. And I'd like to ask each of you where you think the future of medicine is headed based on your view of the world. And I think if you wonder where, I mean, we can start at home, but I'd like to hear your views on where we're actually going.
Well, I think this is the age of complexity, so I think we'll keep embracing the indigenous and the traditional wisdom. At the same time, there'll be cyber knives in cities all over the place. So we'll go towards greater complexity and high tech and wizardry of extraordinary proportions in nanomedicine. And at the same time, we'll just have this hunger and thirst for spirit and belonging and connection and everything else. So I think both will evolve at the same time. So the future is complex and rich and deep.
Good,
Yeah.
good. And you, sir?
I guess in the large sense, the necessity for kind of going back to basic things that make all of our well-being better, whether it's communities. I think there's so much evidence that we spend ridiculous amounts of our budget on health care, but we don't get the proper outcomes that we should be. And because I think our focus for the next best technology, the next best treatment gets us away from some of the basic things that have functioned. So I think that whether it's meditation, communities that are healthy, alongside with laparoscopic surgery, and hopefully you'll move kind of in a rational way with both of these things. Because in places like India, you have kind of the extremes of both, and they're trying to think about how do you not give up the fact that when you have cancer, you want a good oncologist and you want kind of the infrastructure of CT scans and MRIs, but you've moved away from all of the older traditions of meditation, Ayurvedic thought that is, just very much embedded in the country. So,
Yeah.
Where do you think it's headed?
Well, I'm going to ask you one other question first. And that is, since you've worked abroad a lot, there are sort of some practically oriented questions here. So if there is an interest in one about contributing to the greater good, if you will, in a global sense, in sort of a personal way and in the organization that you attach yourself way, what are you looking for? How are you maintaining your own well-being in this work? And how are you ensuring, and Meg, you did touch upon this, and Shri, I think you did too, how are you ensuring that you're attaching yourself to an organization that's worth your time and energy and respect?
You've found some. You found a couple.
Yeah, and you can
that
say something
love.
about Partners in Health or what they,
I
because
tot-
that is a question here
completely.
too, what they represent or what they demonstrate or what they've done that drew you to them, for example.
I think thing about Partners in Health that is so impressive is that they started off like many kind of well-meaning American NGOs working in a silo to be effective. So you brought in very well-trained American physicians, nurses, and you didn't want to kind of interact too much. You obviously had a mission to serve, but interfacing with the public health infrastructure, the government, the local community to that degree, it took, I think, Paul Farmer and Partners in Health several years to really realize that everything we do, it's going to be 95% Haitian, 95% Rwandan, and a few others that come on board. And I think if you're looking at organizations, it's really if those organizations have local people that have really kind of bought into the mission of the organization, run the organization, are the face of the organization. You know, I find it frustrating that, you know, if you think about African development, you think about Bono and Bill Gates, and there's an entire, you know, just so many Rwandans and Haitians that are working towards the same goals. And I think that their voices and their understanding of the work is very deep. So if you want, as an American, to attach yourself to the work, you have to, longitudinally work with an organization over several years so you can understand the work, and then B, find organizations that have really kind of embedded themselves in the community and are led by the community.
I love that.
Very good, yeah.
I think I teach health coaching as well right now, and in health coaching, you just facilitate in a supportive alliance somebody evoking from within them their solution, because those are always the best, the solutions that we come up with, never the ones that are imposed on us. And that same model is just what Dr. Shrees talked about. When you go to a place and you say, good grief, I have landed on a distant shore and I'm in awe of the problems you have here, but let me help facilitate with you as you come up with your own solutions too, because people always have deep within them the best ideas for what they need. And if you can attach yourself to organizations that really hold that at their heart, then you're supporting them with money, resources, time, effort, whatever it is, whatever calls to you, your mission. But always make sure that it's ones that truly respect that individual in that locale about what's best for them. Yeah.
Yeah, and would each of you like to make a small comment on how you maintain your own well-being when you're traveling and working in these settings?
I have some real quirky things. I travel with little tuna fish cans. I put oil of clove on my nose when I get on a plane. I sleep as much as I can. I don't know, and then I get sick. How about you?
There's an honest response.
I think actually in India I got kind of the sickest that I kind of joke around that I haven't gotten sick in Burundi and Rwanda, but in India I got very sick a couple times this past few months. And I think it is kind of some of the support system that you built in, you know, like now I got married in last year, October. It's going to be like 6 months.
Well.
So I think that kind of support structure, people that are close to you, people that you can lean on and trying to take care of yourself, whether it's through exercising or, because I met one physician that was saying, like, we're not martyrs. I never signed up to be a martyr. You try to just have fun doing the work and enjoy doing the work, and you have to kind of bring joy to that. Otherwise, it's, you're going to burn out. And
I like that. I think having your allies with you and identifying them is really important. Loved one, whatever. When I traveled to Brazil with my loving partner, Doug, he asked for permission with John of God to take the photos. And John of God said to him, buy the herbs. And he was pissed off the rest of the day. He was like, why do I have to buy the herbs? I'm here as a photographer. And it was so, but we got to bond over that and laugh over that. And it would have been kind of a more miserable trip for me if I didn't have that. You got to have your allies with you. I think that's really true.
Really good points. And I think you sort of said laughingly, Meg, well, the love is keeping you going. And the truth of the matter is, when you're doing this kind of work, you go as if you're going to give something, but you get so much more back. And it really is, you're on a calling, on a mission, expressing your passion. And it is about love. And I don't want to sound too soupy or syrupy here, but that is what we're talking about. And it does have a healing impact.